Hi, I'm Dr. Andrew Rosenbaum. I'm a PGY3 internal medicine resident at Mayo Clinic, and I'm going to be talking about a manuscript that we're publishing in the Mayo Clinic Proceedings called The Association Between Early Cardiac Rehab and Long-Term Survival in Cardiac Transplant Recipients. So the impetus for this study was the observation at our institution that patients who completed more episodes of cardiac rehab were able to achieve improved outcomes. This observation has not fully been borne out in the literature. There are several randomized control studies looking at cardiac rehab in transplant recipients. Typically these have shown improved oxygen consumption, improved VE-VCO2 ratio, as well as improved secondary outcomes like bone mineral density as well as lean body mass. So we sought to examine whether early cardiac rehab could improve long-term survival in these patients. We undertook a study which was retrospective in 201 patients at our institution. These were all in the modern era from the year 2000 to 2013. We excluded patients who received multi-organ transplants or died within 90 days of transplant, as we were seeking to look at only patients who completed 90 days of cardiac rehab. We examined their cardiopulmonary exercise data at baseline and at years 1, 2, 5, and 10, as well as their medications and their early participation in cardiac rehab. We also looked at whether they had any evidence of early graft failure as well. The results of our study showed that the average age of patients was 51. Most patients were male, and most had mild renal dysfunction at baseline. Approximately 20% of patients were on mechanical circulatory support prior to transplant. We found that medications were most notable for a decrease in tacrolimus over time, as sirolimus was typically utilized. There was a decrease in prednisone dose over time as well. The main finding of our study was that on Cox regression analysis, patients who completed more episodes of cardiac rehab were able to achieve an improved survival long term. This was adjusting for baseline 6-minute walk test as well as early graft failure. We also looked at univariate predictors of survival. Those found to be most significant were weight and BMI at baseline, systolic blood pressure postoperatively, as well as baseline 6-minute walk test. Exercise capacity increased over time. From pre-transplant to post-transplant, we saw an increase, as well as from the baseline post-transplant to 1 year's time. Afterwards, there was a leveling off. We looked at significant predictors of this association as well, and found that post-transplant exercise capacity as well as pre-transplant 6-minute walk test were highly associated with improvement in exercise capacity over time. There are several potential factors that may have been responsible for the association that we saw. Early cardiac rehab is associated with improvement in endothelial function, as well as decreasing side effects of immunosuppressant medications and overall improved conditioning, which could be responsible for the improvement in survival that we saw. Other patients have been shown to improve after cardiac rehab in terms of long-term survival. These include patients after acute decompensated heart failure, after coronary artery bypass grafting, and after percutaneous coronary intervention, suggesting that this effect may be real as well. In summary, we saw an improved long-term survival with early cardiac rehab. We believe that this strengthens the imperative of the transplant physician to encourage the patients to undergo cardiac rehab for their long-term benefit. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.